What if you had an axis on the chair, and so that it could pivot, and it could move forward like this, and so the footrest could actually come down flush to the ground.
That's the prototype of a new kind of hospital chair, aimed at replacing the old-fashioned wheelchair. It's called a Movi. Lloyd Cooper is the designer. Wheelchairs are old. They were known in China in the 5th century, and they haven't changed much. The idea for a new kind of chair was hatched by the CEO of the UAB health system.
About 4 years ago, Dr. Fernani approached us and said, look, I've had this idea that there has to be a better way to create a wheelchair for the hospital, a wheelchair customized for the hospital's needs.
Dr. Will Fernani proposed replacing the wheelchair, never designed for use in a hospital, with a new device that could minimize the risk of falls, reduce lifting injuries to hospital staff, increase maneuverability, and enhance patient comfort and well-being. Cooper, with a mechanical engineering and design background, has worked extensively in automotive seating and chair design.
For someone that needs to sit in a chair, a conventional wheelchair is one of the most compromised seating environments that you can place somebody in. And it should be completely the reverse. Anybody that needs a chair, they need the very best chair.
Movi is easy to move. It pivots, helping patients to stand or sit, and the footrests go flush to the ground. It has room for an IV pole, battery-powered equipment, an oxygen cylinder, even the patient's belongings. UAB has bought 10 for patient transport and has ordered 100 more.
This is the next evolution of the chair.
This is the second-generation Movi, the M2. It features additional padding, side tables, and other creature comforts. M2 is targeted at nursing facilities and home use, and it might find a hospital role as a side chair in a patient room, supporting the growing concept that hospitalized patients do better when they are getting up, sitting up, and walking, rather than lying in a bed all day.
We've gotten so worried about people falling that we've minimized their out-of-bed activity. And unfortunately, we now know that that contributes to pressure ulcers and deep vein thrombosis and functional decline. And so there's all sorts of bad outcomes from encouraging people to stay in bed.
Brown, the director of the UAB Comprehensive Center for Healthy Aging, was part of a team of experts from UAB, physical therapists, exercise physiologists, health and safety specialists, who consulted with Movi Medical on the designs. She's very excited about the chair's benefits for a growing older population.
If you ask any older adult, what they want is to be independent. They want to be able to do it themselves. So in many respects, we owe it to them to keep them as functional as possible so they can maintain their independence even after a hospital stay.
Cooper says the chair was a finalist for the Fast Company International Design Excellence Award, and Movi Medical has launched a Kickstarter campaign. Go to movimedical.com for more information.